so my name is Lindsey, and I am an assistant professor at Northern Kentucky University in the School of Social Work. I have worked at NKU now for almost 8 years. It's an amazing university and an amazing profession. Carolyn and I were just talking before the chat. So I live in Ohio, so in Anderson, if anybody is familiar with that area. We got about 8, 9, 10 inches of snow, so it is awfully cold and extremely snowy. I have one daughter. She is 11. She's in the 6th grade, and a slew of animals. So because there's a camera that's active, it's pretty much guaranteed that you're probably going to see a cat walk across the screen or behind me. So I'm excited to be here.
Our first question is, what can someone do with a degree in social work?
Yes, perfect. So, and I see some of the questions were about my degree. So my bachelor's and master's degree is in social work. I obtained both of those from the University of Cincinnati. And one of the reasons why I decided to get into the field of social work was because it is so broad. There are so many things that you can do with either a bachelor's degree or a master's degree. So I've been a social worker for a little over 20 years. And just to kind of give you a little bit of history of like some of the kind of fun jobs that I've had. So I originally got into social work because my great-grandmother at the age of 94 needed to go into a nursing facility. So when I went to visit her, I just saw, a bunch of people that were aging that really just wanted to talk. To another human being. So that was my sole purpose for getting into the field. So since then, I have worked in discharge planning. So like if somebody is admitted to the hospital, like let's say for surgery, then they get to go home, a few days later, and then they might need help. They might need like physical therapy or occupational therapy. So I've done that. I have worked for hospice. So that is when somebody has a terminal diagnosis and they are going to pass away. That was one of my favorite jobs because again, I just got to sit and talk to people about, how they're feeling, and anything that they may need, just to put a smile on their face. So let's see, then I've also done case management with the medically fragile. So let's say, for example, if somebody is born with a disability and they need like some extra support. So some of the things that social workers do is sort of like link with community agencies that build like wheelchair ramps or like adapt bathrooms. Let's see. And then I've done therapy. So mental health counseling for probably the last 15 years or so. And then of course, so I still have a little bit of a private practice while I'm working as a professor at NKU. A lot of times when you're in the profession, it's extremely important to make sure that you are that you're kind of staying in the know and up to date with how to diagnose people and all that good stuff.
So what are the responsibilities of a social worker?
So there are the social work. Once you're licensed as a social worker, there are a lot of responsibilities that come with the profession. So we have what we call a code of ethics. And we have kind of all these kind of rules, like, for example, we have to make sure that we're putting the patient first or the client first. We have to make sure that we're protecting vulnerable populations. So like, for example, if we find out that there's a kiddo, that somebody is not being kind to, then it's our responsibility to, to go in and to try to help. we're able to admit people to the hospital or make recommendations. We consult pretty frequently with law enforcement. We often talk to the doctor about medications that that patients or clients might need. A lot of responsibility with our role as social workers.
Okay. Our next question is, what kind of environment do social workers typically work in? And if you can just give it 1 second to switch over.
Okay.
All right, you should be good.
Okay, perfect. So social workers work in a variety of environments, even with this lovely COVID thing going on. We are embedded within schools, within hospitals. Sometimes we go into clients' homes as well. They're within jail systems. I'm trying to think. And then, of course, kind of your typical agencies, where you go in and you have cubicles and all of that good stuff. We do also even have social workers that do animal assisted therapy. So we have a couple students that have graduated a few years ago, and now they're doing equine assisted therapy and fun things like goat yoga. Right? Yeah. Yeah, so all kinds of fun things.
That's awesome. I know that a lot of our students who've participated in past events have been super interested in animals. When we did our COVID talk last week, there was a lot of concern about animals possibly being able to get COVID. So I think we have a lot of animal lovers that would like to, be able to integrate these kinds of things into their job. Are there different types of social work? And if so, what are they? I know you talked a little bit about this, but maybe some of the other ones that you didn't mention.
Yeah. So Carolyn, I'll answer that question, but then I'll still talk. So Carolyn asked the different types of social work. So there are essentially two different degrees. There's the bachelor's degree, which is typically a 4-year degree, and then a master's degree in social work, which if you have a bachelor's degree, which we call it a BSW, then you can get your MSW in 3 semesters, so in 1 year at NKU. If you don't have a BSW or if you don't have a bachelor's degree in social work, you can get your master's degree from NKU in 2 years in social work. Different types of social workers. Like I was saying, there's medical social work. Is a big one. We have social workers that their focus is on substance use. We have social workers that focus on, like death and dying. We actually have social workers also, like I'm trying to think of some of the newer trends. Social workers embedded within schools, which we've already talked about. But kind of the cool thing that's happening in the Northern Kentucky area and Cincinnati is we have social workers embedded within police departments. So like, for example, Cincinnati has a homicide unit, which is not a good thing that they have it, but it is, something that they have to have. And we actually have social workers that are embedded within that department, and they go out with the detectives to try to help the families and support the families. And they act as kind of a liaison to be able to speak like, regular human terms when the detectives use some of the words that, normal people or people that are not detectives, have no idea what they mean. So that's kind of one of the cooler trends from my perspective that's happening in our area.
That is very cool. I live with a lawyer, so I totally understand the, need to translate things from law jargon into something that's more understandable by actual human people. So our next question is, what are social work case managers?
Excellent question. So social work case managers typically are BSW level social workers, and they do. And we're actually kind of trying to change the verbiage case manager, which will probably happen in 20 years, to more like care coordination. So, for example, a lot of one of the really popular jobs at the BSW level is to work for the cabinet of Health and Human Services in Kentucky, or Jobs and Family Services in Ohio. And essentially what happens is that social worker's role is to kind of oversee the entire family, and make sure that they're coordinating, everything that they need. So that's anything from obtaining like mattresses, if we move, if the family moves, to paying like electric bills, to coordinating doctor's appointments. When you think of anything and everything that a family could need, that's kind of what social workers do. It's a ton of fun.
That's awesome. We actually have some care coordinators in Owen and Carroll County right now that we work with, who are helping folks who are struggling with substance use disorder, or are seeking help for different things, and trying to get them all coordinated. And I think that the care coordination term, it really makes a difference for folks.
Yeah.
So what challenges do social workers typically face?
Excellent question. So social workers face quite a few challenges. As you can imagine, it's a role that is people that are social workers tend to be kind, compassionate, caring, like they want to fix things. And sometimes it's extremely overwhelming, because as a social worker, you might walk into a family that like Carolyn was saying, that has so many needs. Maybe substance use is the identifying factor of why the social worker is involved. But often when you start, kind of unlayering, or taking off the layers of the onion, you see that there's so many other things that need to be addressed. And that it goes anywhere from if you guys aren't familiar with it, it's something called Maslow's hierarchy of needs, and so you'll learn about this at some point, most likely. So basic needs are kind of like safety, food, water, things that many of us take for granted. So, social workers are it's challenging sometimes when you walk into a house and the heat is turned off, or they don't have enough food for the kiddos, to kind of be able to separate that from like the caring compassion, like you just want to fix it immediately. So that's probably one of the biggest challenges. The other, I guess kind of good challenge is that the social work profession itself is projected to grow at least 25% by the year 2025, which is an awesome thing. But it's also not necessarily a great thing, because we would love to be able to work ourselves out of a job, and there not be a need for social workers.
That's a great point. I think I've worked in nonprofits for a long time, and we all kind of feel the same way. Like eventually we'd like to not have to exist because the problems that we're fixing are solved.
Yep.
So tell us a little bit about where you went to school and what your social work program was like.
Yeah, so Carolyn asked where I went to school and what my social work program was like. So I did my bachelor's and master's both at the University of Cincinnati, and that was just the other day, right? 20 years into the profession. So I and really. So being a social work professor, I feel like I can say this, like that not a whole lot has changed as far as the structure, like you have classwork, and then my favorite part was internship. So as a BSW student, you have to volunteer for a total of 400 hours, and an MSW student a total of either 600 or 900 hours, which sounds like a lot, but it's over a period of time. And so at my bachelor's internship, I was actually able to do internship in a nursing facility, which, I spoke about. That was like my reason for getting into social work. So that was one of my favorite things about school. And then my master's degree, I actually did 2 internships. One was working with kiddos doing therapy, and then the other was actually working at Cincinnati Children's Hospital in the eating disorder clinic, which was, there's another, area of social work that we didn't even talk about. So lots of book knowledge, as far as like, exploring kind of who you are as a human being and how to help people as well. But then also lots of hands-on work with being able to get in there and actually do, do social work while you're in college.
That's great. You've talked a lot about who you've worked with as patients, but could you maybe talk a little bit about who some of your colleagues are?
Yes. So I am a little biased, but I have some of the best colleagues, like within NKU, but then also, outside of the walls of NKU as well. The really cool thing about the social work profession is it's a pretty small, close-knitted community. Like students that graduated from our program 7-8 years ago, like we still keep in contact. So to speak to the NKU colleagues, I get to work with, like, for example, Dr. Jessica Taylor, who founded the free food pantry on NKU's campus. If you guys haven't heard of Fuel NKU before, you should definitely look into it. She is one of the pioneers, essentially, for how to run a food pantry on a college campus. I also get to work with a super cool person named Dr. Holly Reif, who she actually does a lot of focus on social justice. She also leads a lot of the, the movements on campus as far as the LGBTQ, I always type it, the LGBTQIA plus population. And then we also have 2 faculty, Dr. Kim and Dr. Terhune. So Katie and Suki, so they actually work with the geriatric population. So that's kind of their area of expertise. Then in the community, like, it's kind of super cool because, like I was talking about Cincinnati homicide. So Karen Rumsey is one of the social workers. Again, if you Google her, you'll see her all over the news doing interviews all the time. So, like, some famous people. And then, it's also awesome because, like directors at all of the major hospitals. So University of Cincinnati, you're going to hear my cats. I'm so sorry. So University of Cincinnati, the VA, they're the cool thing about being in social work for so long is everybody kind of knows everybody.
Here's a really good perspective into just like the wide variety of folks that you might interact with. So we're coming up on our second to last question. What do you think are some of the most important skills someone must have to be a social worker?
Excellent questions. So skills that are important to have as a social worker. And we spoke a little bit about this earlier: compassion, empathy, the ability to be able to, to be non-judgmental is extremely, extremely important. Like when we talked about going into people's homes, sometimes you walk into homes and they're beautiful, $1 million homes. And then sometimes you walk into homes that have dirt floors, and you have to be able to treat those 2 people exactly the same. The other thing that's really, really important is that you have a sense of self-care. Like I was saying, we as social workers sometimes see some really difficult things. So to be able to kind of, leave it at the door before you walk into your house, and then be able to kind of, figure out how you're going to cope with the stressors of the day is really, really helpful as well. Somebody that also likes to have fun, like I always say, even in my classes, heaven forbid if we actually have fun, while we're learning. So, it's important to smile and laugh and, be able to try to enjoy the time that you're spending with your clients.
That's great. So we do have, it's more of a statement than a question, but I think it says, I still don't quite understand your job. So maybe you could give us like a high level what like a typical day looks like for you. And I know because you're faculty,
Right.
you do a lot of like teaching and research and things like that. Maybe you could also compare it to like a previous position that you had.
Yeah, absolutely. So, Carolyn was saying, more of a statement, like, let's clarify kind of what your job is. So I'm going to talk about the professor role and then the social work role. So for example, from the professor role, I teach the practice classes. So let's say, and this may fold over kind of into what we do as social workers. Okay, so let's say that I am an outpatient mental health therapist. Okay, so I have a kiddo that is saying to their parents, hey, I'm feeling depressed. So the parents say, okay, let me pick up the phone and see if there's somebody that you can talk to about the things that are going on in your world. So it's similar to a doctor's office, like you get an appointment with the therapist, which is the social worker, and so the social worker will sit down and talk to you, and they will say, like, what's going on? Tell me a little bit about yourself. And then we actually have this entire humongous book called the DSM, where we're able to diagnose people. So then, we'll give you a medical diagnosis of like depressive disorder, NOS. So as you're sitting down and talking to that social worker for the first time, that's my job as a professor, to be able to teach that new social worker how to talk to people. So we talk about things like eye contact, nonverbal communication. How do you explain to a client what you're going to talk to about in session? And I apologize because like the field of social work is so big. Like I was saying earlier, I currently still see some clients in private practice, so to do therapy with them. And that process, what it looks like is usually somebody else identifies that this client is struggling. So again, let's go back to depression. So maybe their doctor says, okay, you've been on a medication for depression. We want you to talk to somebody because you can't just take a pill and make everything go away. Mm-hmm. So then at that point, like, for example, today, I just got another referral. So I get an email from a doctor and they say, hey, Megan, Lindsey, we need you to see so-and-so. They're saying that they're depressed. So I have all of their information. So I call them and I say, my name is Megan. Dr. So-and-so referred you. When would be a good time to meet? So then we literally, I say we just sit and talk, but then we get to talk. And then there are all kinds of strategies that we have been trained to do to be able to, work through some of the issues that our clients face on a daily basis.
That actually leads into our final question, which is, are you helping people at all hours of the day, or do you have more of a set schedule?
Excellent question. So, so it was, what are the hours typically? So for social workers, it honestly depends on the agency. So if you go on like Indeed.com and type in either BSW or MSW, you're going to see probably 25 agencies or companies in the Cincinnati area. So, for example, University of Cincinnati Hospital, Cincinnati Children's Hospital, the VA, they have so those organizations that are open 24/7. They have social workers typically on staff 24/7. So like, for example, outpatient mental health therapy, which I still do a little bit of, I usually see the clients during business hours. So like Monday through Friday, from 9 to 5. There are children protective services. Of course, you get a phone call in the middle of the night, with a kiddo that needs help. Then, of course, you're going out. So it really, honestly, just depends on the actual organization that you work for.